Hi, I'm Dr. Fuentes from the Fuentes Cosmetic Surgery Center. You know, I have been asked a lot lately about large breasts and breast reductions. Large breasts is really not an asset. It's not an asset for an adolescent. It's not an asset for an adult. It creates multiple problems. In adolescence, it brings the attention to the wrong part of the body. Besides that, there are other problems, such as discrepancies in the upper part of your attire to the lower part. So you might have a blouse that fits you and the skirt doesn't fit you. There are other problems that are even more significant. It creates difficulty exercising, like running or fast walking, because of the big bounce of the breast. It creates other medical problems, such as a rash underneath the breast that we call intertrigo. That rash we usually treat with powder or drying creams, but it doesn't work very well until you remove the problem. The big brassiere and the weight of the brassiere strap on your shoulder creates big furrows in here. Besides that, it pushes down on the clavicle, which pushes down on the first rib, which compresses the brachial plexus. The brachial plexus is where the nerve comes from the neck into the arm. That gives the people numbness of the little finger and half of the ring finger. That problem does not go away until you remove some part of the breast. It also gives you bad posture. It gives you pain in your breast when you get your period for the adolescents. It gives you shoulder pain. It can give you neck pain. So because of that, the insurance companies may cover the procedure. They usually require approximately 1,000 grams per breast. That is equivalent to about a pound. So that will be weighted by the pathologist, and that will determine after the fact whether or not the insurance will cover you. Although I might tell you in advance that they will, beware because sometimes they do not cover it. The procedure is done either in the office or in the office OR or in the hospital. It's usually done under general anesthesia. On very rare occasions, I have done them with spinal anesthesia. You go home the same day. It does not hurt very much because the procedures that we do in where we do not disturb muscle and bone usually do not hurt. So if I do you on a Thursday, you can probably go back to work on Monday. That does not mean that you can do strenuous exercise right away. For that, I would tell you to wait approximately 3 weeks. The sutures dissolve by themselves most of the time. On occasions, we put a drain that comes out the next day. There are scars or incision lines around the areola, from the areola down to the inframammary crease, and on the inframammary crease. On adolescents, I would tell them that there is a possibility that they might not be able to lactate their children when they are having babies. And they will grow when they are lactating, or if they gain a lot of weight. They could regrow to an extent in where on occasions further removal might need to be done. I think that's all I have to tell you about it for now. I will have probably some pictures that show you where the scars are located. And that's it. Thank you so much for your attention today. Looking forward to seeing you soon. Bye.